Hello dear friends, good evening. We are back with yet another episode of BMC Global Live AlHilal Health World, nothing but lifestyle. This is Jessila Mujib, your host for today. As parents, we are always concerned about the health of our children. Today we are going to discuss about the subject abdominal pain in children. We have with us Dr. Abuzer Surka from AlHilal Hospital, Sitra. He is a pediatrician. He comes with a wealth of experience of 29 years. And about 9 years in Bahrain. He has attended many international pediatric conferences in the Middle East, Europe and the US. So, let us move on to the doctor and know more about abdominal pain in children. So, doctor, welcome to the show and thank you for joining us today.
Thank you so much for inviting me for this talk. It's my pleasure to come and give my opinion on this subject.
It's a pleasure to doctor. So, doctor, we frequently hear children complain about abdominal pain. So, what are the possible causes?
Yeah, this is a very good topic we have taken up today because this is one of the most missed out topic when as regarding the parents seeking the consultation. Because abdominal pain in children can be, we can divide broadly into two categories. One is the pain which is severe, sudden, for which the parents will immediately come for the doctor's advice. But sometime in majority of cases the pain is not so severe, it is dull pain which comes often on, and by some home remedy it will go away, again come back. So, for these conditions the parents usually come very late for advice, and by that time some major problem which was there inside could have flared up and could lead to major issues with the child.
So, doctor, what are the common causes for abdominal pain?
Causes for pain in stomach or abdomen which will vary according to the age of the child. First of all, the causes are very different in the neonatal period or infancy, less than 1 year, and 1 to 5 years there are different causes. Above 5 up to 14 years the causes are also very different. Secondly, the causes in the abdomen. See, abdomen is known as a magic box. Why? Because it contains so many organs. For example, if we go to other things like some eye pains or eye diseases, it only concerns the eye. But abdomen, it may concern so many organs like the liver, the kidney, the small intestine, the large intestine, the urinary bladder. All this having any problem can cause the abdominal pain. So, when we talk about abdominal pain, we need to find out the exact cause, what is causing the pain, and then we need to treat properly. That is how we should scientifically approach any child having abdominal pain. So, now I will explain to you in some detail that how we come to a diagnosis, how we can find out the cause, and then how do we treat abdominal pain. So, to begin with, just for the layman idea, I will give you a brief outlook that for the medical purposes, superficially we divide the entire area of the abdomen into 9 different parts or 9 different regions. We have got scientific names for that, but I will like to put a layman name that we begin with. The abdomen begins from below the chest right up to the lower part of the abdomen. So, how do we divide it? It is divided into three divisions like vertically, upper, middle and lower, and we go to it horizontally. Also there are three means of divisions, right, middle and left. So, right upper, when they pain the right upper part of the abdomen, it is usually concerned with the liver. When there is pain in the middle upper part of the abdomen, that will be usually connected with the gastritis, acidity or peptic ulcer, those sort of diseases. And when it comes to the left upper part, it is usually the spleen which is causing the pain, and this organ is most commonly affected in sickle cell disease. So, patient having sickle cell disease. Then come the middle row. So, in the middle one, the right, center and left again. Right will be connected to the right kidney, left to the left kidney. If the pain is there, we have to suspect these organs, and in the middle it is to the any condition with the umbilicus or surrounding the umbilicus like hernia or any sort of intestinal infections. Coming to the lower range, lower row, the right will be most commonly when there is a pain in the right lower part of the abdomen. It is usually due to the appendix, which mostly everybody knows about appendix, but we do not know about other causes. So, here I would like to emphasize that parents usually feel any sort of abdominal pain, they will consider it only due to appendix. It is not so. Appendix is only one of the reasons. There are so many other reasons. As you may have come to know, that so many organs can be affected. Then coming to the central lower part, it is usually due to the urinary bladder, because urinary bladder is situated over there. So, any infection in the urine or kidney can come down to the urinary bladder, and if it is affected, there is infection, any stone, anything like that, the pain may be in the lower middle part. Coming to the lower left part, that is the large intestine. Usually the colon is there. So any condition regarding the colon like infection or when there is acute or chronic constipation. It is very surprising to know for the parents that even constipation can sometimes give rise to severe pain in the abdomen. It will be left lower part, and for that we need to take a proper history and evaluate, and then when we give medicines for constipation and pain, the child is absolutely normal. This is how we can find out the cause of the pain. Now, how to ascertain the exact cause? Like now, I just told you a brief outlay of which are organs. Now, coming from the doctor's point of view, we have to begin with a proper history taking. History is very important. If the child is old enough to give history, the child can himself tell us how the pain is, where the pain is, how severe, and is it continuous, or is it just started and going again coming like that. Then if the child is not able to tell properly, even the mother or both the parents can help us by giving us proper history regarding the timing of the pain, how the child behaves when the pain is there. Is the pain associated with any other symptoms like vomiting, diarrhea, any other cause? So that we can come to a proper conclusion what could be the cause of the pain. After the history is the examination. Examination is very important. The child has to be made to lie down on the examination table, and we have to check properly. Now here comes that proper good experienced doctor will know how to examine the abdomen, and depending upon the response of the child, like for example there is some severe underlying condition like acute appendicitis or some intestinal obstruction, the child will cry in pain, will shout, will not let me examine. Even if I touch the abdomen, the child will shout and cry, and the abdominal muscles will become hard in sort of defense to my touch. So these all conditions will make us doubt that there is some serious underlying condition. This is not just some normal mild pain, and immediately the child has to be taken up for the next step, that is a proper investigation, and then immediate emergency treatment has to be started. So this is about the history and examination. Now going to the one step further, that how to investigate, what sort of test we do. So test, now from the history examination I should be able to know something that this organ may be affected. So the test will be directed at that.
You mean from the physical test you will just.
Yeah, for the physical examination and the proper history taking, because you see, yeah, because tests are so many, we can't do all the tests in one patient. It is not a good doctor or a good means of the clinical knowledge. Clinical knowledge is very important. I should be able to at least have some suspicion in my mind, 1, 2, 3, these organs can be affected. Not all I do the 40-50 tests is not a good thing to do in a child. So I would just come to a conclusion that these 2 or 3 organs can be or sometimes even I can just pinpoint from one particular organ also I can pinpoint, if the symptoms are so much forthcoming and the examination is so much revealing. But even then, the test when we advise according to the organ which is suspected. For example, liver, if I think there is some liver infection, some liver issue, I will go for the liver test. Then, so likewise, if I am some sort of suspecting some kidney problem, I will go for the renal test. For bladder, I will go for urinary test and all that. So this is how we approach the child. And then after all the tests are done, we come to a proper conclusion. This is the diagnosis, and then next step is the treatment. This is how it.
Okay. So as I mentioned earlier, children always frequently complain about abdominal pain. Then when should we seek medical help?
So this is a very important question we have put forth, because most of the parents feel that it may be nothing important. Let us give some home remedies. Let us give some like stomach pain, colic medicines like that. But as I told you, that abdomen is itself a magic box. It is also not a surprise box. It will give you many surprises. So don't take a risk with your child, because the parents may not be knowing. And I have seen many cases, sometimes parents giving some home remedies for the pain, and then within 1 or 2 days they come with the child having severe pain, and because of those home remedies, sometimes some side effect, or because they missed the diagnosis on the first day, the child may have gone into a major problem. So like for example, some intestinal obstruction or something very severe, and then they have to rush to the surgeon for a surgical emergency. So we don't want to go to that stage. So I would advise the parents, whenever the child is having abdominal pain, complaining, and it always better to take a medical opinion on the first day itself, because the doctor, especially experienced doctor, knows better what could be the reason. It may turn out to be something harmless, but why take a risk when you are not sure? So better you take an expert opinion. Expert will guide you whether it is harmless or it is something serious. You need to go for the steps like that. So seek the medical advice immediately.
Okay. Are there any life-threatening conditions behind this abdominal pain?
Yeah, of course. There are so many life-threatening condition. Just name a few. One is very common, knows almost everyone knows it is acute appendicitis. See why it is life-threatening. I will just say in short that appendicitis means there is an infection of the appendix. Appendix is a very small structure which is connected to the intestine. Now, if it gets infected, it will start swelling. So, when the pain is coming for the child in the right lower part, it is by that time already the appendix is infected and already swollen. So, now if you still sort of delay or prolong further taking medical advice, that appendix may even burst open. Now, imagine in a closed compartment in the abdomen, if the appendix which is full of pus, it burst open, the pus will spread to the entire abdominal cavity and it can affect other organs, and that is a life-threatening condition. You have to immediately rush to the surgical ward, emergency ward, and the surgeon may even take up for the emergency surgery. This is about appendicitis. Other condition is like intestinal obstruction. It happens many times. The parents give some home remedies, or there is some severe infection in the intestine, and the intestine stops working. Intestine gets paralyzed. So, if the intestine gets paralyzed, in that condition, the intestine stops sort of pushing forward the intestinal contents down the intestine, which has to be taken out of the body. So, this thing when it happens, then the intestine will certainly be affected and give severe pain, and if it is not treated immediately, the intestine also may sort of burst open and it can cause life-threatening condition. So, these two are the most commonly seen. Other conditions are there which are not so life-threatening, but there may be so many other emergencies lying. So, always when you take a medical advice and the doctor advises proper investigation, you may be sure that is it life-threatening or not.
Now, doctor, can you explain the treatment options in detail for each of the conditions?
Yeah, so each of the condition will be a very long topic, but I can tell you a few, to name a few. Yeah, so how we approach the treatment is the first step is to reach a correct diagnosis. Because again, I will just sort of, if you compare to other conditions like headache or a simple body ache or pain in the upper limb, lower limb, these things are visible to us. We can easily find out what is the problem and we can treat. But in the abdomen, nothing is visible. Everything is in a closed compartment. Outside, you cannot see inside what is happening. So, again, when going for treatment, first is reach to a proper diagnosis. Try to find out which organ is affected and then we treat. So, if it is a condition of the liver, if it is some simple viral hepatitis, we just advise conservative treatment and it is okay. But if it is something more serious, we consult a hepatologist or a gastroenterologist for the expert opinion. Then coming to the urinary infections, when they pain lower central part of the abdomen. So, after doing a thorough urine analysis and an ultrasound abdomen, we come to know how severe is the infection. And if it is the first episode or second episode, we give antibiotics for the treatment. But if it is recurrent, we need to go for a proper scan because it may have affected the kidney by that time if it is recurrent infection. Likewise, there is some like patient having constipation for a long time or recurrent constipation, then that has to be treated accordingly. So, the answer to the question is that going for treatment is not like treating abdominal pain. Abdominal pain is only a symptom. Abdominal pain is directing you towards something more serious or something more bigger inside the abdomen. We need to find out the cause of the abdominal pain and then treat right accordingly to the diagnosis, and then the pain also will go away, because only if you treat the underlying condition, the pain is going to go away. Otherwise, you just give some painkillers for the pain, it is never going to go away, it will come again and again. This is how we treat in children. But when we go for newborn babies, and it is a very common condition in newborn babies. It is called known as infantile colic. But how the parents will come, the child will only cry continuously, because the small baby is not going to tell you or speak about the pain, or not going to pinpoint some particular place in the abdomen. So, only symptom is excessive crying. This is very commonly I see in my clinic over the last 2.5 decades. That, and especially in the first 6 months of life, because the baby's sort of digestive system is getting used to the outside food, milk, and because before birth baby is not taking anything, after birth mother's milk or other formula milk they are giving, that may cause some gas, some colic in the baby's stomach. So, that is not a serious condition, but that needs to be, because at that age the child is not telling anything. So, obviously parents are afraid, because why my child is crying so much. Then they come to us for medical advice and we diagnose by examining the child. Then I give some anti-colic drops or medicines. The child is okay. This is about newborn babies. And as I told you, when the child grows, the causes also differ. Accordingly, we approach the child with abdominal pain. But most important is there should be proper scientific medical approach, not something haphazard, because abdomen will give you so many surprises, will come out with so many surprises that never, we can say underestimate this abdominal pain. It is always should be looked into properly, so that the child's life also can be saved in certain condition and the child can be given proper relief.
Okay, doctor, another question. How can we handle children who always complain about abdominal?
Always complain means maybe the parents sometimes feel that it's just simply that I don't want to go to school or like that. So here I would like to just say in brief about abdominal pain. We usually categorize into two broader parts. One is the organic and non-organic. Organic means there is something wrong with any organ inside the abdomen. That is a really medical condition. We need to treat, diagnose properly and treat, as I explained to you. Now coming to second part, non-organic. Non-organic means psychological. But when do we diagnose psychological? As you may have understood by now that first we have to rule out any organic cause. The organic causes are more dangerous. So you cannot straight away tell the child is complaining daily means okay, it is psychological, forget it. No. Maybe there may be something really wrong with something in the abdomen. So only after doing all tests and sometimes doing this extensive workup and coming to a proper conclusion that there is nothing wrong with any organ in the abdomen, then only I can diagnose child to having functional or psychological abdominal pain. So now coming to your question, that maybe it is only psychological, then what to do? So then here, why it is psychological, that we need to understand. Maybe the child is having some problem in school, maybe some bullying, maybe doesn't like to go to school, or any other issues with the friends, with the teacher. That's why he is making some other excuse not to go to school. So even that also should not be underestimated, because we need to find out the underlying problem. Why the child is refusing to go to school and making some excuses of having two common things, abdominal pain and headache. These two common, the child will take out some excuse that I have a pain today in the stomach, I don't want to go to school, like that. So parents need to come into this picture and they have to help us to find out the cause. Like they can ask the school authorities. Even a child, they can do some counseling, ask maybe any problem is there, some friend is bullying, some any other homework issue, some study issue, whatever, what is the reason. And then once we find the reason, we need to counsel the child properly, and along with that give some placebo medicine. Placebo means some herbal medicines which is not going to harm the child, but the child feels better, let have taken some medicine, and the child, because there is no organic cause, that's why we have ruled out any serious condition, then only we go to this part, and then we most important is 80% treatment is counseling the child, and the child will be better.
Finally, what's your advice for our viewers, especially parents?
Yeah, advice to the parents would be, from my brief talk, I hope almost all would have understood that abdominal pain should not be taken lightly. We should always find out the cause of the abdominal pain. So my advice in short is that whenever child is complaining of any pain in the abdomen, please consult an expert, consult an experienced doctor, and try to find out the cause of the pain and then treat. Don't go for home remedies for abdominal pain, because you don't know what is the cause of the abdominal pain. Without knowing the cause, if you give something and if really we are missing out something serious, and then within a short time that condition can worsen and your child may have some really big problem or may even go for some life-threatening risk. So why take the risk? So I would advise that whenever child complains of abdominal pain, at least initially take a proper medical consultation with a good experienced pediatrician, so that you can we can go ahead and we are not missing out something really serious.
Okay, lastly, one more question, doctor. Have you had any experience of children having abdominal pain and then treated?
Yeah, so many. I mean, in my such a long career, with thousands of patients we have treated. Some are very mild, some having moderate, some long-standing conditions. I'll just name a few, some conditions I will name. One child had taken child was having pain, like 11, 12-year-old child at home. Mother gave some over-the-counter medicines, not home remedies, so over-the-counter medicines actually for pain. And then the child had a side effect because of the medicine, most probably side effect. And the child intestine got blocked completely. They came after 2 days to my clinic, because that medicine they had taken was without any doctor's advice. They just took on their own. And then they came to my clinic. The child was really suffering so severe pain. I could diagnose immediately that the child is having some intestinal obstruction. We immediately referred to our surgical team, and it turned out to be complete blockage of the intestine. They had to remove some of the intestine, and they had to take for emergency surgery. So this is one condition. On the other hand, I will tell you some mild condition like newborn baby, simple colic, evening colic, and by simple anticolic medicine, the child is happy. So these are this is a broad spectrum of abdominal pain for very mild conditions to life-threatening conditions, and we have to keep in mind as a doctor, as an experienced doctor, I have to keep in mind everything, but not do tests for everything. First, I have to examine, take a history, and then reach to some conclusion, and then go for some further investigation. That is what. So this is about abdominal pain in children.
Thank you, doctor. Thank you for joining us today and giving us a lot of valuable information about abdominal pain. Thank you once again.
Thank you. My pleasure to sharing my information, and hope this talk helps many parents and gives them proper guidance. Thank you so much.
So viewers, as doctor said, if your child is having abdominal pain, go for medical intervention on time and take proper treatment. Till we meet again in yet another episode of BMC Global Live, AlHilal Health World, Nothing But Lifestyle. This is Jessila Mujib signing off. Good night.